Hello, everyone. My name is CLopez. My topic is on translational research and mental illness, and I will begin my presentation now from the Chicago School of Professional Psychology. Oops. So, why did I choose this topic? I will argue that mental illness is socially significant. We all have come across far too many people that are diagnosed with at least one mental illness. At work, most of our clients have ASD, but several also have other diagnoses. In our personal lives, in our families, we probably know even more people that are diagnosed with mental illness. Socially significant. Freeman, Hayes, and Wilson, 1998, discussed that historically traditional psychologists have studied vague subject matter such as anxiety. Really, such topics are not vague. Instead of avoiding such topics, we should be dissecting the subject matter from a behavior analytic standpoint. Behavior analysts should study topics such as obsessive compulsive disorder, post-traumatic stress disorder, mood disorder, and others. Carey and Carey in 1999 discussed behavior research. People with SPMI, severe and persistent mental illness. Under this umbrella, there were people diagnosed with bipolar disorder, schizophrenia, autism, obsessive compulsive disorder, and other mood disorders. Treatment, critical components of the treatment range from functional assessments, skills training, generalization. The interesting part is that less emphasis on the labels, the diagnoses themselves, and the emphasis was placed more on the actual behaviors, on the objective, measurable behaviors. To continue, Cantor, Baruch, and Gaynor, 2006, remind us of Skinner's take on private events. They do not cause behavior. We should take into consideration the surrounding environment. Cantor, Baruch, and Gaynor compare two clinical behavior analytic treatment approaches to depression: ACT, acceptance and commitment therapy, and treatment of behavioral activation, where in ACT, the fundamental problem is experiential avoidance of private events. And with VA, depression is actually not considered an illness, but the direct consequence of a learning history. So the focus is on behavior change, that changing your behavior, and that promotes acceptance. So they're kind of related. And we'll look at some translational research on the topic of mental illness, but first, we need to define it. So what is translational research? Lerman defined it as, in 2003, defined it as a collaboration of basic research with that of applied research. The goal, studying basic processes that will result in effective interventions being used for clinical purposes. An example he talks about is that of delayed discounting research and the application of the findings collaborating with applied research to further learn about pathological gamblers. Translational research on mental health topics can lead to effective behavior analytic interventions for mental health diagnoses. The following will be an exhaustive review of translational research on mental illness. Harvey, Luiselli, and Wong, 2009, examined mental health research that used applied behavior analysis as treatment. They also discussed the history of behavior analysis in mental health. Though applied behavior analysis is more known for the treatment of people with developmental disabilities, the first studies ever published in behavior analytic journals were that on the treatment of severe mental illnesses. However, recent studies do show multidisciplinary approach as treatment for mental health disorders. Such approach included interventions such as antecedent consequence manipulations, contingency management, acceptance and commitment therapy, just to name a few. To continue, Allian and Michael, 1959, conducted basic research with psychiatric patients diagnosed with schizophrenia in a psychiatric ward. Psychiatric nurses implemented the intervention under the guidance of the authors. There's actually a training component where the authors train the nurses on appropriate implementation of operant conditioning and basic behavior analytic principles. And they found that the problem behaviors were decreased by the psychiatric nurses' implementation of operant conditioning. Allian and Houghton, 1962, conducted basic research with schizophrenic participants in a psychiatric ward. Results showed that social reinforcement was maintaining the problematic behavior. They were actually refusing to eat. So they were being spoon fed, tube fed, IV fed. They even utilized electroshock to try to get the patients to eat. And they still refused to eat independently, that is. Eating problems ceased with the removal of social reinforcement. So they stopped spoon feeding, they stopped tube feeding, they stopped the IV feeding, and sure enough, the participants started eating on their own. To continue, Winsley, Leitenberg, and Agras, 1972, again, research on schizophrenic patients. They were examining the effects feedback and token economy had on delusional verbal behavior participants, and they found that the token economy was more effective than the feedback, but both were specific with regards to which environment the interventions were more effective in during training versus the ward. They found a lack of generalization from the training session into the ward environment, which is what we find a lot at work, actually. We probably all do, that lack of generalization. So we've gone over the translational research in mental illness, and we will now consider its application specifically to my work environment. But first, Bailey, 1991, for behavior analysis to be accepted as a valid treatment for mental health, perhaps we should address the matter in a friendlier way. I believe we discussed this in one of our discussion posts. But to formulate advancements like in being accepted as effective treatment for mental health disorders, we need to not only have the effective science to back us up, which we have, but we also need to market our field to allow for such acceptance. For example, we can use less technical language, use language that will be more accepted but not hinder the effectiveness of our interventions. Like we still have to remain ethical, we still have to be behavior analytic in nature, but at the same time, use language that's going to be more accepted. Home-based ABA. Okay, so the relevance of the topic of translational research on mental health is directly related to my work setting. Several clients have a dual diagnosis, though most have ASD, autism spectrum disorder. Some of the other diagnoses that they also have include, but are not limited to, anxiety, attention deficit disorder, bipolar disorder, depression. It's important to be informed in order to educate others. Many parents are provided with diagnoses and circular reasoning or subjective explanations for them. How many of us have heard he's running around too much because he has ADD? He throws temper tantrum because of insert diagnosis here. Sadly, most are parroting what they've heard other professionals say. Thus, instead of placing blame on a particular diagnosis, it is important to understand that it is more effective and, in a way, more ethical to dissect the diagnoses into measurable behaviors to produce behavior change. It's important to conduct that phase to analyze function of a behavior, even if it is mental illness or considered quote-unquote a mental illness. But, dissect it and determine appropriate interventions. That's the beauty of ABA. It's not just for ASD population. Function, intervention, data, analyze the data to determine the effectiveness of the intervention. Function, function, function. With regards to extension of research, future research is needed to test for generalization across other settings, the home environment, school environment, which are all settings that most of us work in. Dual diagnoses. Behavior analysts should investigate the effects that behavior analytic interventions have on people diagnosed with autism and other mental illnesses. Lastly, behavioral pharmacology. Further research is needed in behavioral pharmacology, specifically translational research to further examine effects drugs have on the behaviors of the population we work with and not just on lab rats. Though there has been some translational research on the topic of mental health, there is not an abundance of it in the behavior analytic literature. It is socially significant. We need more research. The end. Thank you so much. These are my references. Thank you. If you have any questions or comments, please feel free to post. under this discussion post. Thank you so much.